Good afternoon and welcome to day 4 of our second annual Inclusive Excellence Week here at the VCU School of Dentistry. I'm very excited, as I've been every day, but today we have some homegrown folks with us right across the way at the VCU Health School of Allied Health Professions. And so both of them are in the Department of Patient Counseling. They'll be talking about spiritual considerations in patient care. Today, we're privileged to have Reverend Angela Flack, who is the Director of Education and an assistant professor in the department. And she oversees the MS or Master of Science program and is also a clinical pastoral education certified educator. We also have with her the chair of the Department of Patient Counseling, Reverend Marilyn Barnes, who is the Director of Pastoral Care at VCU Medical Center and Director of Spiritual Care Department. So we are just thrilled to have them with us today to talk about considerations of spirituality with patient care. And without further ado, I'll hand it over to the Reverends Flack and Barnes. I will say, if you have questions or comments, you can put those in the Q&A, you can put those in the chat, and they will take questions and comments throughout, and we'll do a little bit at the end as well. All right, take it away. Thank you.
Thank you.
Thank you. Hello, everyone. As Carlos noted, I'm Angie Flack, and I've been here at VCU since, I think, probably 2007. And I have a long history with the School of Dentistry. If anyone on the call on the Zoom remembers Bob, Bob Campbell. He was my surgeon for a long time and have lots of stories about him. But nonetheless, it is really great to be with you today, and we look forward to our time together.
And I'll briefly introduce myself. I'm Marilyn Barnes, and I have been with VCU for 77 days. And I am grateful to have the opportunity to be the new chair for the Patient Counseling Department, as well as the director for the Spiritual Care Department at the VCU Health System. And it is Spiritual Care Week. And so I am also grateful for the opportunity to co-lead this presentation and to share with you with Angie Flack.
So let me go to our next slide here. Let's see. All right. So we wanted to start with this quote by Dr. Rachel Naomi Ryman. She wrote a book years ago called Kitchen Table Wisdom. And this quote is as follows: "Listening is the oldest and perhaps the most powerful tool of healing. It is often through the quality of our listening and not the wisdom of our words that we are able to affect the most profound changes in the people around us. When we listen, we offer with our attention an opportunity for wholeness." We thought we would start with just two working definitions, looking at the definition of spirituality and the definition of religion. Christina Pachowski has noted that spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to the self, to others, to nature, and to the significant or the sacred. Then Hill and Pargament come along and define religion as the search for significance that occurs within the context of established institutions that are designed to facilitate spirituality. Oh dear, let's see. I think I just hit the wrong thing. Okay, are you seeing the slide?
The slides went away.
Okay, let me go back to. How about now? Are you seeing?
Yes, now we see the slides.
Okay, I'm sorry about that. I hit the wrong button here for a minute.
No worries.
So in looking at sort of a historical perspective, we know that medicine and dentistry have some very similar histories. Ancient societies looked at any type of ailment or bodily problem and found those to be remedied by spirits, potions, and herbal medicines. We recall the Hippocratic Oath and what Hippocrates tried to do with the four humors. We also see the presence of priests people who were known as rabbi dentists during this time. And I found a particular interesting piece here that said that there was even during the ancient times, there was something known as the beauty of the denture. And that what that refers to is that many people would have dentures, and for those who did have them, they were considered a catch for marriage. And so dentures equaled a good catch for marriage during these ancient times. I had never heard that. And then also we know that during this time we have the Hebrew Old Testament and the Talmud, and they also talk about teeth and well-being. Here is one description of how the folks during this time thought about this. It says teeth were considered to be extremely valuable, not only for digestion, but also for the aesthetics of the individual. Hence the expression a tooth for a tooth. So what this meant is that if a landowner or slave owner during that time caused one of the workers to lose a tooth, then at that point it would have been he would be required to release the person from their work. We also know, okay, for some reason, here we go. Marilyn, I'm having some problems here. When I hit the next button to go to the next slide, it's turning it off. Let me try something else.
And then perhaps use the keyboard for the left and right arrow instead of the mouse.
Here we go. Are you seeing the screen now?
We see the split screen versus
the split screen. That's not what we want. Let's see here. Excuse me, folks. I apologize about this. Just a second.
There we are.
Okay. We also know that during the Middle Ages that disease was looked upon as divine punishment. Roles of the priest and healers were very significant and important to everyday life. Around this time, we have the spread of Galen's work and the use of charms and amulets, especially in Islam. Judaism focused on purity and cleanliness and the role of the doctor. And during this time, there were several indications of clergy, physicians, and also dentists who overlapped in some of the work that they offered and the care that they provided. And then, of course, Christianity offered corruption of the body. And there was the use of the wise sage and the doctrine of signatures. I'm not going to go into all of those specifically. Then we have, at one point, and you may know this as well, toothaches and tooth or teeth problems were thought to be the result of a type of worm. And so there were various ways of reducing the pain and sometimes removing the tooth, as you can see in this photograph here. And then also during this time, we see the significance of Saint Apollina. And I'm going to read to you her story. And that is that she was the daughter of an important Roman magistrate who became a Christian martyr in Alexandria due to the fact that the pagans broke some of her teeth with a hammer, while others were pulled out with the barbaric way of pliers. Realizing that she was about to be burned at the stake, Apollonia asked to be untied in order to pray. The legend tells that while burning, she shouted out to all those suffering from dental pain to invoke her name and thus find relief from their suffering. And she was later canonized by the Catholic Church. And then even today, you might be familiar with this particular chart. This is known as the teeth meridian chart, which shows a connection with a body part and teeth and emotions. And so again, we're looking at how this history has brought us from very early beginnings to even today when we look at meanings and associations between body, mind, and soul. And then we want to think about our present day briefly in terms of history and spirituality. One of the things that we see in present day is that we have opportunities to talk about our values, what's important to us. Over in the hospital, we have a lot of conversations with patients about their values in terms of medical decision making, especially around end of life and treatment. And I imagine that I know when I've been to my dentist or had work done, that we talk about what are my values and how does that create, how does that partner with the treatment and plan of care. We also look at making meaning, and again, this also goes back, historically, is looking at what things mean, what our experiences mean. And again, in the ancient time, many people thought that any type of injury or disease was a punishment or some way of indicating that the person has done something wrong. There is an article that's called Cataracts and Curses. And what this article talks about is that blindness was used as a punishment or a curse from the gods as a result of a crime committed. We also have various references in the Hebrew Old Testament about God breaking the prophet's teeth with a gavel and then trampling the prophet in the dust. That comes from Lamentations. So again, there are lots of ways to think about meaning and understanding when we look at healthcare and spirituality.
If you'll take us to the next slide, Angie. So when we think about religious questions and treatment, there are numerous patients that will ask, why am I sick? Why is this happening to me? Why is God doing this to me? Will my prayers be answered? You can Google and find 20 reasons why your prayers are not answered. We all have heard about bad karma, or that things are symptoms of a weak faith, or that a storm is brewing. I know when I was younger, the wives' tales would be that people who had gaps in their teeth were liars, right? So it was an association with that, and why they had that God was punishing them for lying, or for those who had to have a significant amount of oral surgery. There was a negative connotation associated with that as well. Next slide. So the conversation is important, just as when a patient comes in and there is a consult about either surgery, or there is a discussion about their oral care. It's incorporating what their values are, listening, engaging, and spending the time. And I know time is a valued commodity, yet when a patient feels seen and heard, we know from the literature that people are more compliant with their medication, they're more compliant with their follow-up visits, and the recommendation plan of their provider. So it's not always having that in-depth conversation and trying to take a deep dive, yet it's understanding at a high level, similar to the other questions that patients are being asked, to incorporate that into their patient-centered care. Next slide. So, Dr. Christina Kelsey and some of her colleagues at George Washington University developed FICA, which is a spiritual screening tool. And Dr. Puchowski says this: by understanding what gives a patient meaning, purpose, and hope, providers can play a critical role in relieving suffering for the people and families in their care. So I feel that sums up why we engage with our patients around not only the physical, but the emotional, spiritual, and mental as well. So if we look at FICA, you'll see that the F stands for faith and belief. So to identify, does the patient have a particular belief or spiritual or spirituality? And then what is the importance of that spirituality? How does it influence their healthcare decisions? Because there's also literature that tells us about the influence of religiosity and spirituality in healthcare decisions. The C is for community. So let's dive into the patient. Are they part of a faith community or an extended community? I know that Angie will get into a little bit more the demographics of religion and spirituality as from not only the state of Virginia, but the United States as well. And then the A is for address in the person's care. Again, patient-centered care, and that includes spiritual issues and caring for the patient. So I'm going to take a deeper dive into that. Next slide. So if we look at the F, again, faith and belief, some questions that could be asked: do you consider yourself spiritual or religious? Or is spirituality something important to you? Or do you have spiritual beliefs that help you cope with stress or difficult times? And when we ask a person what's important to them, that's also them sharing their value system with us, which helps us to develop a holistic treatment plan. And then their alternative, because we know that there are many within the community that do not have a particular faith or don't consider themselves spiritual, but we can ask them, what gives your life meaning? Is it nature? Is it peace? What do you feel connected to? And that is where we see the faith and belief. Now, if we move on to the I, then we can see how might your faith or values inform your healthcare decisions. And each of us as individuals draw upon something to inform our decisions. And it's the same thing with our patients. Something informs their decisions. So we could ask them again, how might your faith or values inform your healthcare decisions? Does your spirituality influence you in your healthcare decision making? Moving on to the C. So community. And community could be that spiritual community. It could also be that extended community. For me personally, I have my faith community, and I have an extended community as well that I depend on, and that I bounce ideas off of and ask them what their input is. So understanding who our patients trust and how to engage them and their community and how they do so when it comes to their healthcare decisions helps us again to approach their healthcare holistically. And then finally, the A, address in their care. Chaplains are a wonderful partner in aligning a patient's care with their values. And so asking questions, how would you like me as your care provider to address issues regarding your healthcare? What's important to you? How do we integrate that value system into your healthcare? And to be able to honor that, because sometimes it's not what we want, but it is what the patient wants. And so we're trying to align their values with their care. Angie, I'll hand it back over to you.
What I'd like to do is stop here for a moment. We've kind of gone through, a very rough, brief history with hitting some benchmarks or some important pieces along the historical road. And then we've just looked at the FICA assessment tool. And I'd like to ask if anyone has a comment or a question at this point. Okay, please feel free to let us know if you've got a story or some type of connection with our material or a question, and we will certainly entertain those as they come. We thought that it would be important for us to look at what is the landscape of religion in our country. If we're talking on this subject, we need to know a little bit about the people who walk in our doors. And so this is just a numerical listing of different religious perspectives and their composition, the composition of each of these and how they make up our total landscape for religion in the United States. I like this because it's got some really nice statistics, and it really breaks things down. One of the areas that I want to highlight the most is the unaffiliated or the religious nuns. This is one of the highest and largest growing group in the country right now, with people who are just deciding that they really don't have a religion, and they are the folks that may answer a question about their beliefs as they are spiritual, consider themselves spiritual, but not religious. And then here's a different way to look at it. This is from a different resource, but it comes from the 2020 American Values Atlas. And again, we can see how our religious landscape is comprised across the country. If you'll look here, based on what I just said a few minutes ago, this 23, according to this particular resource, has the unaffiliated as the largest group of people in this landscape. I think that's really, really important for us to know as we look at religion and spirituality. And then if we want to move on to Virginia, so Virginia is the 14th most religious state overall. 61% of adults in Virginia are highly religious. 60% say that religion is very important. 44% say that they attend worship services at least weekly. 60% say that they pray daily. And 67% say that they believe in God with absolute certainty. Obviously, this type of statistical framework is really important for us because this means that, this gives us a nice description of people who are walking through our doors, the role of religion and spirituality, and how that plays out into their daily living. Then we want to move to the next slide, and I'm going to hand this over to Marilyn as we talk about ways to engage the chaplain.
Thank you. And I did see in the chat, someone put that they would welcome additional training and practice utilizing FICA with patients. And so I'm going to address some of that in this slide. So as chaplains, we are your partners in healthcare. Just as you have expertise, we have expertise as well. From an education perspective, providing education on religious practices and values that you may not be familiar with. We are a resource for you. Clinical practice integration. And so providing language for incorporating what I do term as the 6 social determinants of health. I know that it's not documented anywhere, but I always add that additional bubble for mine, because I believe that that body, mind, and spirit is key. And we are a resource for helping you to integrate that into your practice. For example, using FICA, as well as the active listening, encouraging each of us to listen, to hear, and not to respond. And then also we have resources. So research on evidence-based practice for incorporating spirituality and religiosity into your practice as a particular provider. Before we move to the next slide, are there others who would like to enter into the chat or come off mute to share how you may be integrating spirituality and religiosity into your practice, or any other questions?
Sure, I'll offer a prompt if that's okay. So I come at this from an ethics background. So I'm our director of ethics curriculum as well. And I know there have been, and DEI, and there have been some conversations. I did a presentation with the American Society of Bioethics and Humanities recently around dental ethics and COVID-19. And there is some loose conversation. It's well established within the hospital setting for ethics consultations, for chaplaincy consultations, those sorts of things. But it's kind of a total anomaly in dentistry because of our delivery of oral healthcare services. The model is just so different, right? It's typically whether institutionalized, like here in sort of a dental hospital, dental school setting, or a private practice setting. So there's been some discussion around having ethics consultations chairside, having inclusion and diversity consultations chairside. What are your thoughts, or how would you see someone perhaps even in a private practice setting establishing relationships with religious figures in their community or chaplains in their community to be a resource in kind of that modality that's, you know, so different from, you know, the hospital setting where you can be paged and just round up, you know, to the floor, if you will?
Thank you for your question. We as a team were having our retreat this week, and we had talked about vision. And part of that vision is community type based chaplaincy, so that when someone comes into the hospital or some other type of healthcare setting, which dentistry is, that it's not the first time that they're hearing about a chaplain, and don't see them as the pastor, but more as that companion, and helping how they integrate their faith or what's their value system into their care. And that is the vision that I have for the department, is that we're able to do more community type based, and more, not necessarily always with faith communities, yet with social organizations and with certification or certifying body organizations on how to understand what chaplains do, not only in the healthcare setting, but outside the healthcare setting.
Thank you so much.
Absolutely. I look forward to an email from you so we can discuss further. That's good partnership. Are there others? I will say there are no right or wrong answers, no right or wrong experiences, and that we're all here to learn and grow from one another.
Before we move to the next slide, I'd like to share an experience that I had years ago in Louisville, Kentucky. I worked with Carmine Esposito at the University of Louisville Dental School. And one of the programs that he and I developed were in his work with students and dental residents was that every so often, maybe once a year, sometimes maybe even twice a year, he would require all of his students to make an appointment and begin the process as if he or she were a patient coming into the clinic. And so part of the assignment is that the resident or the student would make the appointment, go through all of the onboarding that occurs with the appointment, actually come to the clinic, wait for their name to be called, and to sit in the dental chair and wait for the dentist. And part of his reasoning obviously was so that people would remember what it's like to be in the chair, what it's like to feel that level of vulnerability that sometimes people feel, and he wanted them to maintain that connection as a part of their best practice as dentists and oral surgeons. And obviously I've never forgotten that. It was just such a very powerful experience. And especially when they came back to our small group and we were able to talk about their own observations and self-reflections. It looks like we have some more questions or chats here. I'm going to go ahead and go to our last screen, and then we can just open up for a full dialogue and questions. So, and Maya Angelou once wrote, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And with that is the last slide. And why don't we just, I'll stop sharing, and then we can move back to just dialogue and conversation about your experiences.
Angie, there's a question, and I'll read it. It says, "Greetings, great presentations. In my limited experiences, I have noticed an increase in the recognition of spirituality by healthcare providers. My cadre of providers have been more open in sharing their spiritual journey. Is this a function of changes in training?" Well, I'd love to say it is. I will say that there are some schools that are medical schools, and I believe dental schools and nursing schools, that are opening or providing more than just a didactic, if you will, on religiosity and spirituality. I honestly believe, and in the previous position that I had, was working towards integrating it more specifically into simulation and around having an OSCE, if you will, that would be focused on spirituality and religiosity that medical students would need to go through, and to have periodic, review to keep incorporated into their practice. So I hope that answers your question, but I believe that it is something that is very important. And thank you for sharing.
Yeah, and if I could piggyback on that too, we've been talking about patient spirituality and religiosity, but I think also we need to keep in mind the beliefs and values that we have as caregivers, and what's important to me, what's important to you, in ways of practicing your beliefs and your values in your work and your vocation. And how does that help you cope? How does that help me cope? And it's really not one of those things, I think, that's just that catchphrase, self-care. Self-care gets tossed around a lot. But I think when we really start to think about what are my values, what do I believe, what does it mean to have a human-to-human interaction, then if we do that and we practice that, then we all become more person-centered and patient-centered. And I think we cope with the stresses of everyday work life. And in doing that, we're able to keep coming back every day and doing what we do, and not doing it without feeling or thought, but doing it with intentionality and authenticity.
That's so great. I want to point out one comment from someone that says, I've had the pleasure of working in, sorry, it skipped. I've had the pleasure of working in a private practice that actually prayed with their patients before their dental work. It was an amazing experience working there. And so I want to kind of flip that into a question for you all. I know that, so my dad, I'm from South Carolina originally. My dad is a lifer with his periodontist, which is a gum surgeon. And I know his gum surgeon is a Christian and my dad is a Christian. And I know that he does pray with a lot of his patients and has little devotions in his office, and not in a proselytizing sense, but obviously I'm biased because I'm a Christian, and so there's that might be skewed. What do you all think are your insights around that practice? If a patient is okay with it or desires it, versus the tension of if that seems too much on the proselytizing side, or if it may be offensive to a patient. That a lot of times in dentistry, particularly, we have kind of open bay office design. So if a patient that is within earshot hears that and maybe they're more offended by it, what do you think you do, or could you direct us around some of that tension?
Angie, you want to go first, or you want me to go first?
I'll let you go ahead.
Okay, so I will say that as chaplains, we have that same tension, right? Because, for example, I am a Christian, I'm Methodist, yet I may be invited to care for a person who is Greek Orthodox or Jewish or atheist, and I'm coming alongside them where they are. So I have offered, may I hold you in my prayers, right, in my personal prayer. So then it's not me saying I'm praying for you, but I'm holding you in my prayers. It makes it personal. I would also invite, similar to when we are caring for people, to empower them to say, like you said, Carlos, may I pray for you? May I do this for you? And that empowers them to say yes, and does not make healthcare or I'm just going to be transparent. I don't like going to the dentist. It gives me high anxiety. So when I see the dentist, my dentist always tells me to calm down, because he knows that's the space that I'm in. So to be able to connect with people where they are and to focus on that patient. So whether you have numerous bays, your focus is on that person for right then. Angie?
I concur with everything that you've said, Marilyn. And yeah, I don't have anything else to add.
And I put it in the chat, but I want us to maybe discuss it a little bit. I think one of the things that commonly can present itself in a dental patient care setting is we use a variety of materials in dentistry that are constantly being innovated and constantly new things. And so it may be someone who has a belief system, they don't want any metal, but it could be, I don't want to say deeper than that, but more religious in origin than that. So you may have a patient, for example, who's Jehovah's Witness, who does not want any kind of product that some of the products we use are from a bovine origin. So from a pig origin or something of that sort. They don't want, if there needs to be a bone graft, there may be very specific questions, or they may not know to ask those questions. Like, we as the provider know the origin. How much is there a due diligence on us to be informed if they don't know the right questions to ask, but we know their faith story? I just remember very specifically in dental school, I had this Jehovah's Witness patient who she wanted an implant. She said she wanted an implant, but she really needed a bone graft. And so that was nearly 20 years ago. We didn't have many options for her outside of an animal product. And it was very clear that the resident who had talked with her, who would have done the procedure, was not sensitive to that, and maybe even was a bit false or misleading in that. And then when she asked me, it was like, well, no, this is what you think it is. And so how do we navigate maybe some of those conversations?
You let me know, Angie.
Want me to hop in? We'll just tag team on this one, Marilyn.
Okay, all right.
Because I think this is a great question, and it's something that we could probably spend several hours discussing. But I think the issue is, and we talk about this a good bit, is transparency, and letting people, giving people the facts, the whole story, and then talking with them about, their beliefs. And sometimes that may require some uncomfortable questions. And if we're not used to that kind of dialogue. But I think the more conversation, if we go back to one of the slides and we keep this conversational, the more conversation that we can have to know that person's wishes, then the better off we are. The other thing that I think is also really important is to practice active listening, so that and there are lots of ways to do that, but active listening is a way that I can let somebody know, hey, I'm really listening to you. Let me go back and ask you about something that you said about the use of bovine tissue, or whatever it would be. And so again, back to that, how we make people feel when we truly engage them in this conversation about something that's very important to them, then they're not going to forget that. And that conversation, I can't guarantee it. I don't think anyone could, but I think that just having that level of intimate conversation with someone may help them to make a decision that was different from the decision he or she may have thought about making before they sat down for the conversation. But also, I just think it's just a very healthy conversation for, I'm just going to use a global term, practitioner and patient. And again, I think excuse me, I think, having that frank conversation is only going to serve everyone well in terms of developing trust, and in terms of really putting together a treatment plan that is going to be workable and viable.
Thank you. Can I pipe in one more thing, Carlos?
Yeah.
And everything Angie said about the transparency, I will also offer that we ask people about their allergies. We ask them about their blood type, those types of things, right? So when I'm asking you about your allergies, if I ask you, do you have any concerns about the products that are in whatever I'm going to use, right? So it's the same thing. If we link it to that, we ask people about their medications, we ask people about their allergies. If we ask them what's important to you from a value system, and these are the products that we're going to be using, then we are being transparent and as providers, just integrating it into the already very long list of questions that we ask people.
Yeah, I think that's probably, if I could anticipate pushback, right? I think particularly as more practice settings are corporate run as opposed to individual owner practices in dentistry, I think that time ethic, the time issue and chair utilization and how long appointments are, and how long are our intake forms already in terms of adding things to them. So I think it would be interesting, that nuance of how we navigate that. And it's not much more to add one additional question, but then if we learn 5 new things, are we adding 5 questions? So I would anticipate that could be some of the provider pushback, but I think it's very helpful. And I agree, it's in that same trajectory, right? Around your medical history and your values and your beliefs. Is there something about your spirituality that's directly important to you for your healthcare or delivery of your healthcare? Doesn't seem a hard inquiry to come up with. Yeah.
And think of it from an ethical perspective. We ask about your allergies. We ask about your medications from an ethical perspective. So
Sure.
if pig products or blood products are part of your value system and not having them is important to you, then we should know that, right? So if we can look at it from the ethical lens.
No, I totally agree with you there. Yeah, yeah. No, so anything else you want to add or other questions at all for our presenters today? Well, just on a personal note, I was so excited, and I still am. We're going to have some follow-up conversations because I know I'm among a rare air of probably dental clinicians that have an MDiv. So I did not a year of CPE, but I did like a semester of CPE as a part of my MDiv program, and it was really one of the most informative things I've ever done. I was assigned to a peds cardiac unit at Duke Medical Center. And it was immensely stressful because I think as a dentist, we're so used to kind of millimeters and widgets and, you do this, you get this, you do this, you get this, as opposed to kind of just sitting in that tension or sitting in and not necessarily feeling useful or filling the atmosphere with words that I deem useful, but just kind of sitting that what we would call ministry of presence, of course, in sort of that vein. But it was fascinating. Just one anecdote that I'll say, I remember in that PICU, that peds cardiac, there was a Hindu family that had twins very, very, very early and were not doing well, but they always wanted a chaplain, even though they were Hindu. They just wanted someone there. And so I think it certainly had shaped me in different ways around how I communicate. And we do some of this. We have some interpersonal communications. We actually have some behavioral scientists from you guys' college, the College of Health Professions, that teach our students around disparities, interpersonal communications, that do some vignettes. I'm not actually sure if we do a formal OSCE that introduces that, but that probably is something we need to consider, because I think, I know when I was a student, I will never forget, we use standardized patients when I was trained, which are, for those that are not familiar, basically actors that are paid to come in and have some particular cultural lens or perspective. And it was a Islamic woman who wouldn't shake a man's hand, that wasn't her. And I'll just never forget that, because I'm from the South, I'm Southern through and through. And so I reached my hand out, and I remember getting graded down because of that, but being sensitive and just understanding different folks' lenses. And so I think this is in vein with that too. But anything else you guys want to add at all before we close it off for today?
One thing I would like to add is I want to offer an appreciation for what you all do. And I'm going to share with you something that I tell our students when they come in through orientation. The work that we all do is is not always normal. It's not normal to go to work every day and be with people who are in pain. My sister-in-law goes to work every day. She gives people their money when they come through the drive-through at her bank. Everybody's fully clothed. They're not having any pain. No one's doing something to them. And so there's a sense of this that it becomes a part of our lives, but it's also not normal. And it does take its toll on us as individuals. And so I want to say, give you my appreciation, and also to say, I know that we were involved a few years ago when there was a very unfortunate death there in the clinic. And I want to say that we want to be helpful and supportive to you, not only during those times that are in that manner, but any way that we can be helpful and supportive to the care that you give to so many people. We would feel really honored to be able to do that and partner with you. As you said, we've got to have more conversations, but just want you to know of I'm speaking for us, as our appreciation.
I echo what Angie just said. I want to thank you for the invitation to share and to say that we are definitely your partners in dentistry. We see you, we hear you, we are here for you, and you're not alone.
Well, thank you so much. This has been such a joy and a pleasure. And so stay tuned. The Reverends Flack and Barnes, and we're gonna have some conversations and maybe come up with some pilot projects or some ways to really interconnect this work so that our students and faculty and residents can have some different experiences, particularly with that well-being piece. I think that's important that we provide care for our colleagues as well. So thank you so much for the presentation. It's been very enriching. Everyone, please join us tomorrow for our keynote, as we'll have a presentation from Daisy Lovelace at the Duke Fuqua School of Business. We'll be talking about she'll be talking about unconscious bias and moving to conscious inclusion. So stay tuned and thank you for joining us. Have a great day.
Thank you.
Thank you.